Hi, this is Forrest Lightberg on the board of the Santa Barbara Response Network. I'm here today for our Compassion Center this Wednesday today. Today is about mental health for our first responders during COVID-19. I'm here again with Gina Carvalho, one of the co-founders of the Santa Barbara Response Network, as well as Dr. Sherilyn Lee, who is a licensed first responder. She works at the Sheriff's Office in Santa Barbara. And so I just want to take a brief moment and pass this on to Gina for a second, who may have a few words to say, and then I'll introduce Dr. Lee.
Okay. Thank you, Forrest. Welcome, everyone. Thank you for taking the time on your busy Zoom schedule and online schedule to fit us in, because I know we're all experiencing an influx of invitations and programs. So I'm very pleased that the Santa Barbara Response Network today could have Dr. Sherilyn Lee on. We've been partnering on many community issues, but we are part of the community wellness team, which was formed after the debris flow to respond to mental health issues in our community after traumatic incidents like COVID-19 and others. And it's a wonderful partnership between Santa Barbara Response Network, the community wellness team, and the Sheriff's Department to really be able to put mental health messaging and put mental health support out in our community, not just to our families and our children, our elders, but also to our first responders, the people who are really on the front lines, the people who are taking so much of the burden on our community that they're also going to be highlighted. So thank you for taking the time and for joining us today.
Absolutely. Thank you, Gina. So I just want to open this up, by the way, for our audience. If you have any questions throughout this, feel free to leave them in the comments section of this Facebook broadcast, and we will be sure to address them. Okay, so I want to introduce Dr. Lee. Dr. Sherilyn Lee is a licensed first responder psychologist and has been working with first responders since 2014. She started as a volunteer with the Sheriff's Office and was hired as the department's first behavioral sciences manager. Dr. Lee currently manages the Sheriff's mental health co-response teams, the jail's medication assisted treatment program, is a member of the hostage negation team, manages the department's crisis intervention training. Dr. Lee also has a private therapy practice where she exclusively sees first responders through Santa Barbara Police Foundation's At Ease program. Dr. Lee, I want to thank you so much for being here today.
Oh, thank you for having me. It's my pleasure. It's a topic I love to talk about and I think is really important, of course. So happy to have this platform and happy to be here.
Absolutely. Thank you very much. So to just start off here, I want to ask you what issues or concerns you're seeing with law enforcement and first responders during COVID-19.
Yeah, so that's a great question. I think I'll start with talking about just some numbers to put things into perspective. We started as a country recording police suicides a couple of years ago. And last year, in calendar year 2019, 221 police officers committed suicide, which is a much higher number than those that were killed in the line of duty. So we're facing an epidemic within the first responder community, and specifically with police and fire, when it comes to suicide. And so adding a stress like COVID to an already stressful environment is difficult and is not going to help that statistic, in my opinion. Like many of us who were used to having stressful jobs and going and coping by hanging out with our families or going to camping or going to concerts or events, all of those coping mechanisms and outlets are no longer available to us. And the same is true of first responders. So I think that's having a severe effect on all of us, first responders included. There's no pressure release valve for them. And there's still the expectation to do the job and to show up and to be professional and to make the hard decisions they have to do every day is still there. but their ability to sort of decompress in between days on and days off is not. And that's going to add up, and that's going to be problematic.
Absolutely. That makes a lot of sense. Wow, I had no clue about this before, you know, and how big of an issue this is in the first responder community.
Yeah, and I think the first responder community is getting a lot better about talking about the challenges of being on the front lines and seeing the things that they see. You know, if we're lucky in our lifetime as civilians, you know, we may not experience any trauma, or you know, maybe experience very little or secondary trauma, right? If we're in the healthcare profession as therapists or psychologists, we may hear our patients talk about it. What cops and firefighters experience on a daily basis is out of the norm for most of us. And that adds up over time. And so what communities are recognizing now that we're keeping numbers is that we have to pay better attention. Healthcare professionals have to pay better attention to this population and do more to help them. Mental health has been a stigma in the community. This is no secret. We talk about it all the time, even more so within the police and fire professions. And so those folks were even and are even less likely to reach out for help for a variety of reasons. And so one of the things I'm really proud of in our community, specifically in Santa Barbara County, is that our district attorney, Joyce Dudley, Santa Barbara Police Department and their foundation, the Santa Barbara Sheriff's Office, we've all gotten together and talked about the need to increase services for the first responders in our community and make it acceptable and okay. And a part of the job is to get help and take care of yourself. So I'm really proud that our community has stepped up to make those conversations and resources available.
Absolutely.
It's so important. And Sherilyn, I know you as a therapist, and I'm sure your background in trauma and the interest you have in understanding trauma. And I would think that with first responders who may have compound trauma, so this just is building one upon the other, and without that, you know, that valve, that release valve, or that processing. So how, you know, this is so important that we're able to talk about this. I mean, we all have our own even early childhood trauma, and then to be on the front lines and experience multitude traumas, of course we're going to have it's going to have an impact on the psychological health of these individuals.
And I think another thing unique to COVID to point out is that most cops that you ask, you know, they'll tell you they're prepared to go into a situation and take on bullets to save a victim. Or, you know, they're willing to put themselves in the line of danger. They sign up for that. They do that every day. They never know when that call is going to come out, where they have to make decisions that are life and death decisions. What's different about COVID is now the fear, in addition to those fears, which are still real and still valid and still there, they're worried about contacting somebody in the public who's sick and taking that home to their spouse and their family. And that's a very different kind of stressor. And so it's okay for me to get hurt. That's what I signed up for. But for my family to get hurt, that's a whole different, you know, sort of psychological stress. And so I know a lot of our first responders too are separating themselves physically from their families. They're living in their RVs, they're staying in the guest house, they're isolating in a particular room in the house because of that fear. And it's a very real fear, but that's something new that they haven't had to necessarily deal with before, not at this scale.
Yeah.
Right.
So,
So,
and they're still going out and responding, is what you're saying. You know, our law enforcement is still going out and responding to calls.
Absolutely. Yeah, they don't get to stay home. So we're doing our best as an organization to identify potential, you know, COVID positive houses, and, you know, we're doing our best to advocate for our first responders to get the appropriate PPE so that they can protect ourselves. But it's a very different kind of stress than what they're used to.
Right. Now it's come to my attention that this is Police Officers Week. Is that a national week or? Oh, great. Okay. So just because it's Police Officers Week, I want to ask you what resources and activities you'd like to share about
Sure.
that are occurring that the public, that our audience can support our responders through.
Sure. So there's a very large social media presence. So one of the things that we do during National Police Officers Week or Police Officers Memorial Week is we recognize those that have passed in the line of duty. So we're on a social media platform, so it's appropriate to talk about social media, right? So I've noticed that Santa Barbara Police Department is putting out information about officers that have died in the line of duty, and they're going to be doing a virtual memorial on Friday. I don't have the specific information about how to access that or what time, but I can get that to you. And we at the Sheriff's Office will also be highlighting. Oh, I'm sorry, Gina, go ahead.
And we'll post that. Thank you,
Oh, okay.
Sherilyn. We'll post it.
Okay, yeah, I'll get that to you. You know, we're doing the same at the Sheriff's Office. Just the sheriff put out a press release on social media on Monday, recognizing the men and women of the Sheriff's Office. And so I think what the community can do is they see somebody in uniform and thank them. That goes a long, long, long way with the folks that are working 12 or 16-hour shifts and haven't seen their family in 3 days, and have been spat on or cussed at, or have, you know, just come back from a traumatic medical call. Saying thank you, waving hi, it really does make a difference in somebody's day. So that's what I would recommend. Yeah.
So what tips or advice would you have for the responders right now and for their families who might be feeling overwhelmed, stressed, isolated, concerned, worried? I mean, it's just such a crazy time. And I can only imagine what it's like to be a police officer or first responder right now with everything going on and with how confusing things are for almost everyone right now. So what would you suggest? What are some of your tips and advice for the responders and their families?
Well, you said if I could only imagine. After COVID, if you want to join our Citizens Academy, I'll make sure there's a spot for you, so you can learn what it's like to be a first responder. It's a great program that we have at the Sheriff's Office.
And what is the Citizens Academy?
Yeah, so you get to learn about arrest and control techniques. You get to learn from different facets of the Sheriff's Office. So the unit that I manage, the Behavioral Sciences unit, comes in and talks about mental health response. Our detectives come in and talk about what they do. You get to see some forensic. You get to experience a force option simulator. So you get to pretend to be a cop for a moment with a pretend hostage and see how you would do. And it's really a hands-on course, learning what it's like to be a police officer or a sheriff's deputy. So it's a great way to educate the community about what it is they do.
God, that is so fascinating.
And there's a barbecue at the end, and the sheriff comes, and it's, you know, so free food is always good too.
That is fascinating. Never heard of that. Oh my goodness. So interesting. So what tips would you have for first responders right now?
Yeah. You know, coming from the position of, I'm a psychologist, right? My number one tip is always going to be, it's okay to ask for help. That it's not a sign of weakness. It's often harder to ask for help and admit that things aren't okay. And it takes an act of bravery and will and valor to pick up the phone and say, I need some support. I would say you don't have to do it alone. Yeah, I just think there isn't enough times that anybody in that profession can hear that, because that profession, being a first responder, can feel very alone a lot of times. So I would also say exercise. So when we get into the science and biology of stress and you know, accumulated trauma, the sympathetic and parasympathetic nervous system of the body, you know, which I'll spare you all the boring, you know, kind of mumbo jumbo details about that. But basically our bodies can get out of whack when we experience too much trauma or too much stress, and we don't actively and intentionally decompress from that. And so one of the best ways to do that is exercise, and not sitting on the elliptical for 40 minutes while reading, you know, a novel, although that's not bad, and may or may not be what I do these days. exercise where you get your heart rate up, and there's an achievable goal. So I'm a big fan of powerlifting. And so when you can set a goal and you can really activate those systems in the body, that really helps to regulate those systems that help with things like hypervigilance and stress reaction. So exercise. I would also say remembering that connecting is important. So if you're isolated from your family, if you're isolated at work because you have to maintain social distancing, it's okay to reach out for folks to just connect with in whatever way you can connect. Zoom meetings, calls, having game nights. There's a lot of creativity there, but we don't want to lose how important it is to connect with the folks that bring us up. And because the profession can make first responders feel so alone, there has to be intention behind that. So it's not just waiting for that connectedness to happen, but going out and seeking it and making it happen. Also, eating healthy. So, this is not just for first responders, but the general community is, stress eating. And if we put good things into our body, we tend to feel better. If we put bad things into our body, we don't tend to feel so good. So the basics. COVID is going to be a marathon, right? And so we have to set realistic expectations and pace ourselves. But if we don't set intentions behind taking care of ourselves, that's going to get lost. We're going to forget about that, and that's a problem.
I was going to ask you about the relationship between diet and the foods we eat and stress levels and stress management.
I have to say, there was a news article that came out that McDonald's was giving out free meals to first responders, and I was so aggravated. There was only, this is, I take my kid there, we get ice cream, that's fine. But there were 3 or 4 meals you could choose from. It was like a double cheeseburger and, a McMuffin or something else. And it made me angry.
You're like a PR move, right?
Right. And I'm an advocate for our first responders taking care of themselves, and you have to do that with diet and exercise and mentally. It's all connected. At the risk of sounding like a psychologist, it's all connected, and it all matters. We have to pay attention to all of it.
Sure. Hey, Gina, did you have something you were saying?
Yeah, I wanted to ask Sherilyn. I was so interested in your work, your individual work with the responders in your practice. Is there like I think there was a peer-to-peer program. Is that still happening? And are there groups, or I know now by Zoom, but is there a way that they're reaching out to each other and how that's been going? Or
yeah, so that's a great question. There's a really robust evidence-based practice in policing and in fire called peer support. And that's when you have a cadre of folks who are good at talking, good at listening, available, sign up to help those department members when they need help. And so it's not a psychologist, it's not somebody with letters, it's not somebody that does a fitness for duty evaluation. It's somebody who's been there, who wears the same uniform, who at 3 a.m. When you're trauma of the infant call you were on earlier that day that didn't go well, you can pick up the phone and somebody's going to be on the other line and say, hey man, I get it, this sucks, what do you need? So peer support is also available for critical incidents. So when there's shootings or when there's like the mud and debris flow, peer support can be really helpful because peers, your people that you work with, have been there and have been through it. So we at the Sheriff's Office have a peer support program. I know Santa Barbara Police Department has peer support. Santa Maria Police Department has peer support. County Fire has peer support. And with the leadership of Joyce Dudley and the Santa Barbara Police Foundation and the At Ease program, we're really working towards a countywide peer support program for first responders, because it may be somebody in my department doesn't want to talk to somebody else that they know. They want to talk to somebody in a different department. And so we're trying to make that more available and more advertised and more a part of our culture. There are some police agencies that have personnel dedicated to things like peer support. San Diego Police Department, for example, they have an entire unit, a sergeant, I think 3 officers. All they do is officer wellness. That's their entire job. And so it's nice to meet folks like that at agencies like that and take some of that back to our home.
Oh, I'm so glad to hear that's happening, because I know that peer to peer, it's almost like when we talk about responding to youth to youth, peer to peer. They want to talk to their compadres, the people that are sharing the work with them or the life experience. It means so much. So I'm glad that that's going on. That's fantastic.
Yeah. As long as there's minimal alcohol involvement, it's get a thumbs up from me.
Let's not go out and have a drink together, right?
Well, there are stereotypes, right? And stereotypes come from a place too. So when we talk about coping, we can't talk about coping and not bring some. So we just always want to be mindful that that's not our only coping skill, and it's not the coping skill we use at 9 o'clock in the morning.
Yeah, right.
So do you have anything else you'd like to share with the police officers, their families, first responders, the community at large, as we continue to go through this time? What else is inside your brain right now that that you feel would be really valuable to share here?
I just think it's important to remember that we're all in this together, that law enforcement, fire, they're a part of our community. They've got a uniform on Monday and they're in Albertsons line in sweats on Tuesday. And so I think for a few years now, there's been a trend in the community, not necessarily our community, but in larger communities across the nation, about an us versus them mentality. And I think, if nothing else, COVID has really shown us that's not who we are. We are, at the risk of sounding cheesy, we are all in this together. And my heart is for our first responders. We need to support them. We need to advocate for them. We need to make sure they have the equipment they need to do their job. We need to make sure those resources are available so that when they call the at ease number, there's somebody on the other line to pick up and to talk with them and to get them to where they need to be. And I think it's important to remember too, for the community, that our first responders world hasn't stopped. A lot of our worlds have stopped and changed, but theirs hasn't. And so the more gratitude that we can show and kindness we can show to each other, I think the better off everybody will be. I'm always an advocate of be nice to your neighbor, because then the cops don't have to show up. So I think if we can cultivate kindness and compassion, that's not only going to help us, but it's going to help them. And that's where my heart is. Yeah.
Right.
Yeah. Sherilyn, on a personal level, my son is a first responder. He's also in the military. He's a first responder, he's an MFT, EMT, he's a firefighter. I mean, it's just like that. So I was speaking with him. He just had a baby. They just had their second child. And he said, well, if I got called out, I go. And he said, that's what I was trained for. That's where my heart is, in my work. And I'm starting to understand that more and more firsthand, that really is something that's deep within the heart of the first responder, is to be of service. They really are service providers. And he said, if you take that away from me, you take away what, where my heart is. Of course, he loves his family, but if he gets called, then he's going to respond. And then, of course, then I think about the wives, the children. They have to come to terms with that's the calling that their partner has chosen, husband or wife. So I've come to understand a lot that it isn't just duty, that it's very deep, and there's a camaraderie between the people responding to the fires and to the incidents. That there's it's more than it's a brotherhood or sisterhood. So I do really appreciate what you said about saying thank you and appreciating and giving, being compassionate with those folks that are still there day after day, keeping us safe. So
Yeah.
very, very important.
Well, thank your son for his service for me, please.
I will.
I will also mention that the At Ease program through Santa Barbara Police Foundation is not only available to first responders, but to their immediate family members as well.
Mm-hmm.
So spouses and children can also benefit, because you're right. When you're a first responder in a family, you're a first responder family. Everybody's affected because you get that call and you go. And that's a unique position for our folks and our families to be in. Absolutely.
And I'm sure all the first responders know about the At Ease program, but it's probably on the website for the Sheriff's Department and the Police Department. I would say that's probably pretty well-known fact for our first responders. Would you say that, Sherilyn? That they
absolutely, yeah, so yeah. The information is out there.
Just taking advantage of that. That's there for you.
Right. And I should also say, there are other organizations. Oh, sorry, I didn't mean to talk over you, Gina.
No, I'm fine.
I was going to also say there's other resources and organizations available. There's always EAP, the Employee Assistance Program for county employees, and Santa Barbara Psychological Foundation, which has a great cadre of psychologists and folks that are ready to, to help our first responders. And always through insurance, there's options. And so I speak from Eddie's because that's what I know, but there's a lot of different resources available to folks.
Yeah.
Very nice, very nice. Well, thank you so much for all your work. And, as we come to the last moments of this broadcast here, we're just under 30 minutes here. I just want to see if there's anything more that you would like to share with us. And Gina, you as well. So I just want to open this up and have time for any final remarks.
I think I said it. And just so folks know, I'm always available. My information's on the Sheriff's Office website. I'm easily accessible. So, you mentioned a little bit about what I do with the mental health co-response teams and, the response in the community. So I guess my final thought is that I'm available for all of the above. So if folks need anything, feel free to reach out anytime.
Thank you, Sherilyn. And that's so nice to have people get to know you personally, because I know you really mean it. And I know that there is help, and also through the Santa Barbara Response Network and part of the community wellness team, but that you can reach out to us anytime to help families connect with services. And that's what we do too. And there is plenty of support for anyone who's listening to this and is wanting for themselves, their child, their neighbor. There is help, and there are people just ready to talk with you and support you through whatever you're going through. So I always appreciate the opportunity to talk to our community and the people that are doing this valuable work like you do, Sherilyn. Thank you very much.
Thank
just
you.
Gratitude as well. No. Gratitude for what you're doing and for our first responders. Thank you, Forrest.
So thank you both so much for this great gathering, and very informative gathering. And if you feel like this has been a complete conversation, then we can conclude. We're just at the 30-minute mark, so I'm if you're ready to close this out, I'm going to do so.
I will. Thank you all. Have a wonderful evening.
Thank you all for joining us again. This is the Santa Barbara Response Network. Our website is www.sbresponsenetwork.org, and you can learn a lot more about us there. Thank you very much for joining us, and we'll see you soon.